they say laughter is the best medicine, right?
That's true.
And oftentimes, if you've been there, if you've been through the struggle, you know how true that is. So I'm looking forward to this visit tomorrow night from Dr. Dan Shapiro. He's a clinical psychologist, and he's has written a few books now, but his latest, A Funny Thing Happened on the Way to Chemotherapy. You don't often say that. His lecture Tuesday night at the Memorial Art Gallery. And thank you for joining us by Skype this morning. We appreciate it.
Oh, delighted to talk to you, Alexis and Jennifer.
I was just looking up some of your past speeches, and there's the two type of night nurses. I was just watching that one. For people who've been there, they know these struggles, and you probably connect with a lot of folks who are going through tough medical times, don't you?
Well, I certainly hope so. And the lecture I'm doing tomorrow night is named for Ben Sishi, who was a real humanist there in Rochester, who practiced for more than 20 years. And hopefully the talk will make people laugh and maybe inspire them just a little.
And what do we get out of the book, A Funny Thing Happened on the Way to Chemotherapy? Can you give us a little synopsis?
Well, so the book is titled Mom's Marijuana, and it's not actually about marijuana. It's about the fact that in the face of real struggle, we have to take a square look at what's important to us and then live that way. But there are some pretty funny moments in the book. You know, in the face of a cancer experience, you don't expect things to be funny, but there are these strange experiences. And my mother, who was a real talented gardener, ended up growing this huge crop of marijuana because it was helpful for me when I was going through the chemotherapy.
Yeah, not something you expect normally to say, but there you go. That's where your life leads you, doesn't it? I want to ask, because you've been the patient, but you also are a doctor. You have both perspectives. Your talk tomorrow night, is it aimed at patient? Is it aimed at doctor? Is it aimed at caregiver? Is it aimed at everyone?
It's actually aimed at all groups,
okay.
Both the docs who really, I think most really want to practice humanistic medicine, and also for patients. There'll be a lot in there that I think that resonates for them. You know, if you've been on the front lines going through this sort of experience, you'll understand.
Yeah.
You say humanistic medicine. What do you mean by that?
I mean medicine that is patient-centered. Too many of our systems are still really difficult for patients to navigate. Everything from where you park to how you get your information and your prescriptions are really set up much more for the convenience of the practitioners than they are set up for the convenience of patients. And when we stop, when we really focus on what patients needs, that's what we call humanistic, and that's the model that Ben Sishi, Dr. Ben Sishi, who this lecture is named for, really set for all of us.
And Dan, can I ask you, since you've been on the other side, been a patient, what that moment was like for you when you were given that news that you had cancer? And what was the moment when you decided to, I'm going to look at this head on, tackle this head on, and you kind of take a humoristic approach to things? And how do you pass that advice on to others who are going through this?
So for me, it was, like for all of us, getting a horrible diagnosis is devastating, right? It's earth-shattering. It changes the way you think about everything in your life. And yet I learned going through it that having a certain sense of humor about it, trying not to take myself too seriously, or some of the minor inconveniences, let's call them, along the way, helped pave the way for a smoother experience for me. And I think it can do that for a lot of people.
I love it. I've been through a lot in my life in terms of medical stresses. That's putting it mildly. I love it because so many times you say, if I could just tell everyone this, and you're doing it. How that must feel so good on behalf of all patients to be able to be like, you all have no idea about X, Y, and Z, but let me tell you about it.
I think it's rewarding to connect with other patients who've been on the front lines. I think illness can be really isolating and really painful. And so when we're together, we have an opportunity to learn from one another. And I actually had some pretty impressive things happen because of other patients who were incredibly helpful to us. I have 2 children because of the wisdom passed down by other patients about infertility treatment that I didn't understand when I was going through the experience. So connections between patients can be really powerful.
Amen to that. Amen to that. You can hear him tomorrow night, the Memorial Art Gallery. We are so looking forward to your visit here. And thanks for your time this morning. And thanks for a good laugh, even with such tough stuff.
Oh, good. The memorial lecture is at 6 o'clock.
Very good. All right.
Thanks,
Make
Dan.
a date. Make a date.
Take care.
We appreciate it.